49 is not reimbursing any individual vision and dental plan premiums. Yes, sir. Not
Doesn't,
you.
doesn't Medicare pay, if you're diabetic, you're supposed to have your eyes checked once a year. Don't they pick up that difference that Medicare don't pick up?
So he's asking if I have an eye condition, and does Medicare cover my eye visit? Yes, because that's tied to a medical condition. What Medicare does not cover is you just walking into, 20/20 eye vision and getting your eyes checked and dilated just for vision.
I go once a year.
That'll be fine because Medicare will cover that. And yes, sir. Sure.
You have no local representation in the healthcare rate, but you gotta call it 800.
That is correct. Yes, sir.
Okay, I have a pre-existing condition, some kind of cancer, will that be okay?
If you are getting treatment or having screenings done for cancer, those will continue under the Medicare Humana plan.
No, what hospitals, except Humana, is there Loveless, Humana Hospital?
Loveless and UN, it just won't be Presbyterian.
And all my doctors that are associated with Presbyterian, I don't know if they take Humana or not.
They won't. If they're with Presbyterian,
Well, yeah, if they're sole practice by themselves, they take more than just Presbyterian.
Oh.
What I'm saying,
Yeah.
the ones I have are associated with Presbyterian. What I have to do is call their offices and check and see if they take Humana.
you probably will need to see the lady and gentleman in the back. You can always call your Presbyterian providers and ask them if they'll take Humana. Our understanding is, they probably will not, but you can certainly check with the Presbyterian reps in the back and have that question, because I just don't know off the top of my head.
And that's what I stated when we began our meeting here, we're gonna have this presentation, and it might not fit some of our retirees, and we're gonna have Presbyterian, and it might
I
fit
agree.
the other
I
ones.
heard that. I'm just curious because some doctors will go Presbyterian only and some will not.
Yeah. So that's why Local 49 is gonna give options. If you use that system and you love them, then choose that plan.
I don't love them that much. For 10 years.
Well, 10 years is a long time. They know you. What other questions do you have about Humana? Yes, sir.
Question about prescription drugs. If you get the generic drugs across the counter, you have to pay $5 on.
Yes, if you do generics at retail, it's $5.
Okay, I pay nothing now. Okay, I just wanted to know.
Yes, ma'am.
On your, show that does not cover Chavez County,
So she's asked,
in Chavez County.
so Medicare requires Humana to list a very long list of counties where we're filed and approved in. However, we also have from Medicare a waiver. And the waiver allows us to operate in all counties, in all states. So just because you don't see your county listed, it does not mean anything, because you're still covered under this plan because of the waiver. So these benefits still apply. There'll be no issues for you. Yes, sir.
When my wife becomes Medicare eligible, can she come into this plan?
Yes, she'll be sent an age-in kit closer to her age-in date with Humana information for those.
One of the requirements that SMART, our international, is putting on these, that they have to be dues paying members. So as long as it's a retiree and you continue to pay your dues, we're offering the plan. And that's one of their requirements to us, and they want us to verify that each member, retiree, that's gonna be going through the SMART Humana plan or the Presbyterian plan, that they're still union members, they're dues paying members, or members in good standing.
What would happen if something happened to me before she became eligible?
Since you were on the plan, I believe I think she would still be eligible to come into the plan. I'm pretty sure, yes.
Does she have to pay dues?
No, it's just the member. We have spouses. My mother's one of them, that my dad passed away. She's still in the plan because my dad was, and they don't have to pay them themselves.
They still have to pay the deductible. This is deductible per person, is that right?
$147 per person deductible, just one, yep. And yes, ma'am. And that is required language that we put in there. So won't apply to you.
So that's verbal confirmation.
Verbal confirmation, and we'll have to go back and have that we'll discuss that comment. Typically, when you have out-of-network plans that allow you to go out-of-network, sometimes the cost share is greater. If you went, on your first visit, if you go to a doctor and they charge you $200, all you have to pay is the $147. The rest of the $200 is picked up by the Humana plan. And once you've done that, you have no cost share. So if you go out-of-network or in-network, you have completely satisfied your portion of payments. So the plan will pay at 100%.
Okay, another question, I called to check on the doctor.
Mhm.
There is no radiology listed, there's no radiology listed, there's no x-rays, MRIs, ultrasounds, in Albuquerque.
Are you using facilities today? Are they accepting Medicare?
They are.
Have you asked them if they'll bill Humana?
No, I called Humana.
Okay, well, Humana's just going to give you a list of who we might have contracted, but this plan, again, it gives you out-of-network benefits. So they don't have to be contracted. The providers that you guys see today, they don't have to be in our network. As long as they take Medicare and will bill us, you can continue to see them, and they don't have to be contracted. So I know the representative might just have gave you a list or not given you a list because we didn't have any, but it won't matter. If the providers that you see take Medicare assignment, and it sounds like they do, as long as they'll send the bill to us, your care should not be interrupted. You can see those providers.
So if there's, let's say there's a large hospital bill and they do not bill Humana, then you be responsible for that person that Medicare does not cover, and then Humana reimburses that.
Typically, in hospital situations, they are going to work with Humana in advance, unless it's an emergency. And in emergencies, we pay those bills. They should be billing us. So at that point, you shouldn't be having to be balance billed those situations. Again, Loveless is in our network. The other hospital in New Mexico is in our network. If you prefer Presbyterian, then you will simply enroll in the Presbyterian plan, and you'll have coverage through them. Yes, ma'am. Then I'll get to you.
If we chose to have an emergency situation, like them through Presbyterian, would they deny that claim?
I can't answer that question. I'll have to defer that to them. Okay, she said no.
No, it's actually a law. Any hospital is, by law, required to take an emergency patient, so we would never.
Even if they weren't admitted, if they just got seen in the emergency, even then discharged, they would still bill it. So what if they went inpatient, would they still bill it at the same, so?
They would bill
So it would still be a zero copay? I mean, a zero, Humana?
After the deductible of 147. Yes, sir.
There are co-payments on prescription drugs.
There are co-pays for prescription drugs, and those are listed in your book. We went over those earlier. So you can check that out, right here, sir. And look at that,
How much is the co-payment?
$5 for tier 1, $30.
No, I mean a co-payment, like I pay for Walker, they charge me $18, sometimes a month, and my prescription, is there a co-payment on the prescription?
There will be co-pays or co-insurances on all your prescriptions.
How much is the co-payment?
It'll depend on the tier of the drug. Whatever drug your tier falls on, that's the co-pay that you'll pay.
That's all I have to pay?
And that's all that you'll have to pay, is whatever the cost of that co-pay is for that drug.
That's it, then.
Yes, sir. Thank you.
Let's talk about donut hole.
Yes.
It was $40-some hundred, is that correct?
Well, $3,310 of cost in your drug to get you to the donut hole.
Okay, so if I'm on tier 3 and I'm paying, and it's a brand name, I gotta pay 45%, correct?
Yes.
So if I do that for 10 months, I'm gone, or 9 months.
Gone, meaning,
The donut hole is gonna eat me alive.
and then you'll move into the catastrophic phase of your plan. That is certainly possible.
And so at that point, if that cost of that prescription I'm taking is $357, I'm stuck with the $357 for the next 3 months, right?
That will depend. So if you're on a tier 3 drug, depending on the cost, when you do get into the coverage gap, you will be responsible for 45% of the cost of the drug. Whatever that might
45 or the total thing after the donut hole? I'm talking about the donut hole. I'm
In
in the donut hole
In the
now.
donut hole, when you go to the pharmacy and you go to fill your prescription, and it's a tier 3 drug, whatever the retail cost of that medication is, You will be responsible for 45% of it.
Well, I thought if I hit that, let me back up. If we hit that donut hole at $30-some hundred, that means that you're not gonna pay zero on those prescriptions after that, correct?
You will pay, we'll pick up 55%. You're responsible for 45%.
Even after we hit the donut hole?
Yes.
Then what, the donut hole up to that point, what's it doing for? I mean, prior to the donut.
Prior to the donut hole, you're in what's called the initial coverage limit. So from the start of the plan until you spend $3,310, that's the initial coverage limit, and the cost share is on the top row, $5.
Well, 60, let's go to $60.
$60.
$60, so then at the end of,
Once you reach the end of the initial coverage limit and you move into the donut hole, instead of paying $60, you have to pay more.
I gotta pay the 45%.
You have the 45% co-insurance.
Okay, I just want everybody to understand that,
Yeah.
because some of us are taking, medication that, is gonna do exactly the scenario I'm
I
talking about.
understand, yes, sir.
Okay, thank you.
Yes, sir. Yes, ma'am.
When do we have to decide?
When does the decision date need to be made?
What was it, December?
December 7th.
December 7th.
December 7th is when your decisions will need to be made. And I believe, Local 49 will be mailing information to you with a selection form in it that will allow you.
There's one that's gonna be going out in the mail, and it's gonna give you the three options. You're gonna, by default, everybody's gonna be enrolled in this one. If you prefer Presbyterian, then you check the Presbyterian box. Sandy?
And we have that form available today, if you're ready to make a decision.
Okay.
Your 1-800 number, send out, you can get information on Medicare and.
Hold on. Yeah. Yeah. Hold on. Can we keep it quiet? There's one question on the floor.
The eye care and the dental through that 1-800 phone number.
You'll need to go to Humana.com, because the phone number that's listed in your packet is for the custom group Medicare service center. It's not the individual. So you'll need to go to Humana.com, where there'll be phone numbers listed for individual dental and vision policies that you can get more information regarding. Yes, sir.
If I elected to enroll in this plan, right now my wife is enrolling in everybody else's in. If she turns 65, does she have the option of going with this board system?
Yes.
So the same option I would have.
You know, and these options that we have right now, the trustees of the plan, every quarter we evaluate stuff and we go through the funding. You know, this plan is being offered this year. We have to go back and see. It depends. Our health and welfare depends on our man hours that our guys are working at. Hold on, can you please? You know, and it's all based on man hours that our men are working at, our guys out in the field. You know, so if those man hours increase, we're able to provide a service. If those, like in 2010, when our man hours decreased and we had high unemployment, you know, it puts the plan, it hurts the plan because there's no money going in and there's money coming out. So we're gonna be evaluating this on a yearly basis. And for 2016, this is what we're offering. You know, things might change. It all depends on how the Affordable Care Act goes, the cost of medication, cost of doctors, and it all depends. So right now, for 2016, this is what we're working on. You know, we're gonna get together, we're gonna be monitoring this plan, and hopefully the man hours will stay up and we'll continue to subsidize them. But all I can say, and again, like I said when we started this, I don't have that crystal ball, and I wish I did, because this way I could tell you exactly what's gonna happen for the next 5 or 10 or 20 years. We don't know. But for 2016, this is the plan that we've got in place. Okay?
What are they classified as, Plan 1 or Plan 2? Because when I called that informational number, they wanted to know what plan that I would be on.
So your question is, when you called into the Humana customer service number,
Right.
we just made the decision to add Presbyterian literally late last week, so they're not even aware of Humana yet.
Right.
We're gonna put that out in our customer service notes, so when you called in, option 2 is really what you're on with Humana, but you'll have the Presbyterian option. And we won't be able to speak about the Presbyterian option, because we're not licensed and appointed to do so, but we'll just speak about the Humana plan. It's option 2.
When I was talking to them, they called it the smart plan.
Smart plan.
I mean, they know what your benefits are if you tell them
Yes, sir?
I forgot.
That happens.
Silver sneakers, I've got an ID card, it doesn't have any precedent. Will that be the same carryover, like?
If you have a silver sneakers card from another plan, you will receive a new one from the Humana plan. Yes, ma'am, and then I'll get you.
If we're signed up with the VSP on the one exchange, do we just keep paying it? Or do we have to get completely off of everything on one exchange?
Cindy, can you answer that?
It's my understanding that you'll continue to pay it, you just won't receive a reimbursement for that anymore.
Yes, sir. Do you have a question?
Oh, yeah, the letter we received at home, there was no option.
That's because it's new.
Either receive this or nothing.
Yeah.
Yeah, you know that letter, we had the Presbyterian plan, actually, we were talking to Presbyterian plan a week on Thursday, and that's when all of this came up, okay? So you're gonna be receiving some additional correspondence that's gonna have this information on there. This is something that just really came up Thursday last week. So you're gonna be,
Hurry because re-enrollment is December 7th, that's only a couple of weeks.
well, we've got that, and the, letters went out in the mail, or they're going to be going out?
They're going to be going out today.
Okay.
Enrollment cards will go out too.
So enrollment cards, you're gonna receive your enrollment card in like the second or third week of December. So you're gonna have your ID card before January 1st. You will also receive your evidence of coverage with Humana, that big thick book that looks about like this. The evidence of coverage is gonna have all your medical benefits in it, all your prescription drug benefits, as well as your grievance and appeal rights. So you each will receive one of those evidences of coverage before January 31st, if you enroll in the Humana plan. Yes, sir.
Don't you have to be enrolled by the 7th under the law?
So he's mentioning December 7th. Keep in mind, guys, that right now we're in the middle of the individual open enrollment period for Medicare. This custom group plan does not follow those rules. We will enroll you when we get the enrollment information, but we have special enrollment rules that allow us to enroll you at any time in a group Medicare custom plan. But if you choose an individual plan and you don't want the plan offered through Smart Local 49, then you do have until December 7th to make that decision and get that on file with Medicare.
Okay.
Yes.
Do we have to make any phone calls or anything to enroll, or just make the cards?
You don't have to make any phone calls to enroll. If you want the Humana plan, you will automatically be enrolled in it. If you want Presbyterian or you want to opt out completely, you have to make an action. Fill out the form and send that back in to Southwest Service Administrator so that they can note your election. Any other questions for the Humana plan? I'll step inside this room so that if you have any questions, you can come see me. And then, of course, the Presbyterian folks will be coming up and sharing information about their plan. And I really appreciate your time today. Yes?
If we do go with the Presbyterian for this year, for 2016, but we change our mind for 2017, we wanna go with Humana, will we be able to do that?
You know, again, we're gonna be reevaluating this every year.
If they still have Humana.
Right.
Humana plan is still there, we would be able to.
Yes. If, once we reevaluate this, the trustees get together and we look at this plan again.
What will this plan, Humana plan, cost the local?
Right now,
Per
okay,
person?
right now, this Humana plan is gonna cost the local $174 per member. 174 for the member, 174 for the spouse. The Presbyterian plan, we're looking at 214, okay? You know, we had a presentation down in El Paso for our retirees in the southern part of the state and in El Paso area. You know, and the members working out there, we're gonna continue to subsidize these plans. But, you know, we need the help of the retirees when elections come around. We really need your help. You know, we need you to go out there and vote for labor-friendly people that endorse labors, you know, and labor issues. You know, because we can't do this on our own. You know, we have the members and we're gonna continue to subsidize them, but we had a hard time just last year fighting right to work. You know, so we need your help, you know, and when we call you out to call politicians or stand up or write letters, help us out. Because this is one of the ways that we can help our retirees. You know, and I'm gonna continue to do that, but we also need your all's help. So, get out, and I'm not telling you who to vote for, all I'm saying is do some homework and vote for politicians that help labor and endorse labor. Thank you. Roseanne, you wanna come up?
Thank you.
Good morning,
You did good,
everybody.
take the rest of the day off.
Okay, so I don't have a PowerPoint, today, because everything happened literally within the last 24 hours is that we were gonna be here, so, but I understand we're gonna have another, enrollment meeting if you actually wanna come and hear, everything about Presbyterian. I'm just gonna go over some highlights of what the plan is. So most of you, if you've been on Medicare for a while, you spent quite a few years on the Presbyterian, PPO plan that we had for the sheet metal workers. So what we're gonna be offering you this year for 2016 is our HMO point of service. Presbyterian is a New Mexico organization. We're here, this is where we live, this is where we do business, and we've been around for 107 years, so we're really proud of the fact that we are a local company here in Presbyterian, and here in Albuquerque. One of the things that I like to kind of start out when I especially this year when I'm talking to people is, you know, you've heard about the star rating of Medicare Advantage plans. Has anybody heard of the star rating, the Medicare star rating? Medicare rates every single Medicare Advantage plan throughout the country. And this year, for 2016, Presbyterian's HMO product, which is the product we're gonna put you on, is actually the highest rated HMO plan in the state of New Mexico. We've just been rated 4.5 stars out of 5 stars. So what does that mean? We're the only plan in New Mexico, the HMO plan, that is rated that high. It means that Presbyterian is doing the right things for our members and for our patients. Lots of things go into how they grade us, but a big part of that is how we treat our members and whether or not they are happy with the way they're being treated, whether it be customer service or the quality of care, whatever. So again, Presbyterian is very proud. We're very thankful that Vince reached out to us because we know that there's a lot of people here that are very, very much connected to the Presbyterian system in the state of New Mexico. So the plan that we're offering you is the HMO point of service. What is an HMO point of service? Well, you know, an HMO is basically you gotta stay within the network, right? But the point of service is the key. The point of service says that you can go to any Medicare approved provider anywhere. Anywhere, as long as they will accept you, as long as they're Medicare approved and as long as they will accept you. You can go to MD Anderson in Houston, although we have MD Anderson right here in Albuquerque, right, at the Caseman facility, as well as our Rest Medical Center. But you could go to MD Anderson if you choose. You can go to Denver, Colorado to get your health care. You can go to Chicago, Illinois if you want to get your health care through the point of service. Of course, we cover you for emergent and urgent anywhere in the world. You're covered anywhere in the world for emergent and urgent. It doesn't matter if you're in the on the front steps of the Loveless Hospital visiting a friend and you fall over and they take you into the emergency room, you're covered. It doesn't matter if you're in Denver, Colorado. It doesn't matter if you're in Taiwan or in Hawaii. It doesn't matter. You are always covered for emergency services.
Yeah, but that's only if you still located here. If you relocate, say I move to San Antonio or someplace further, Pres will cover that.
That's exactly right, because we are only, you have to live within the state of New Mexico.
And Humana is, anyway,
You
relocation.
can live anywhere in the United States with Humana, that is correct. That's one of the differences between the Presbyterian and the Humana. But as long as you live in the state of New Mexico, you're eligible for the Presbyterian plan. If you move out of the state, let's say you move to sunny Arizona in July, why would you wanna do that? But some people might, right? Then you have a 60-day enrollment period. Medicare allows you to move to another plan, so it would allow you to move the Humana plan if you chose to move out of the state. So, yes, sir.
Is there a differential in cost, this HMO point of service, than what we had before? What we have now?
It's very similar to what you had before. So there's gonna be an in-network benefit. As long as, when you're going to the in-network, to the contracted providers, and let me just qualify the contracted providers. Many people believe that if you're in the Presbyterian plan, it's only Presbyterian providers. It's not. We contract not just with Presbyterian primary care doctors, all the ones that are in the Presbyterian medical group facilities all over Albuquerque and all over the state, but we're actually we've contracted recently with independent primary care doctors in the Albuquerque area. So you have access to not just Presbyterian providers, you have access to contracted providers as well. So anytime you're going to a contracted provider, it's considered in-network.
Is the
Yes,
difference
you
in
do
cost?
have out-of-network benefits. You can go to any Medicare-approved provider anywhere, and then you have to pay an out-of-network copay.
But the differential in cost between the two plans,
They're between the two plans.
the existing one that we have now, for this HMO point of service, is there a differential in cost? What I pay premium-wise
premium?
for my copay?
Well, I don't, copays could be different. It's been 2 years since you've been on the Presbyterian plan,
Well, they
and we
dropped it.
have changed some copays,
They
yes.
dropped it last year, but, I mean, what I pay,
Your
one exchange.
copays might be different. Your
No, when I mean
copays,
copays, I'm saying what I paid up front, like I did at one
that's your
exchange.
copays. Those are your copays.
No.
Anything you pay to the
I mean,
doctor, no?
My premium, what I pay for my premium, is there a difference in premium cost?
From what you paid 2 years ago?
No,
I don't-
what I paid last year, I paid $85 a month.
Oh, I don't know, cause I don't know what plan you're on today. I don't know what
Well,
plan.
it's what was the plan we were on, it's PPO,
So this is an employer group plan, okay? The plan that you're gonna be on now is an employer group plan. Some of the things that you're gonna get through the employer group plan are better, are going to be much better than what you are used to if you were on a Presbyterian individual plan over the last couple of years. For example, the out-of-network, ability to go outside of the network to the point of service. That will be an additional benefit. One of the great benefits, and I want to speak directly to one of the questions that you had, is Presbyterian's HMO point of service employer group plan has unlimited prescription drugs. There is no coverage gap. We have no coverage gap in our benefits. You do have to pay co-pays for your prescriptions, but you don't have to worry about that $3,310 initial coverage limit. If you take a lot of prescriptions, then you're only gonna pay co-payments. The next level would be if you do ever spend $4,850 out of your pocket, then your co-payments go down, as Natalie described, for the rest of the year. But you don't ever have to worry about paying that 45% or any of those higher amounts, because we don't have that in our employer group plan.
Right now, most of us, I think, are in a PPO, and the donut hole hits at 2,600.
29, yeah.
Oh, well, whatever it is.
And this
So
year
that was
would be-
my question. So now, if we go into the HMO, you're saying it's going to $40-some hundred, is that correct?
You don't really have a coverage gap.
We don't have a donut hole?
It's taken away for you. There is no coverage gap, there is no donut hole. You're gonna pay co-pays, and then if you spend out of your own pocket $4,850 in co-pays, which some people do if they take a lot of prescriptions, then your co-payments go down for the rest of the year. So you never have to worry about paying the 45%. You're just gonna pay the co-pays that are listed in our plan, okay? Whether it's, whatever tier it's gonna be on. So we've got, we're gonna cover you for all the same things that, Medicare's gonna cover you. We're also gonna cover you for the things that we give you over and above what Medicare covers. We give you an eye exam every year. We give you a hearing exam every year. And Presbyterian also provides you the Silver Sneakers fitness membership. So you've got that available to you as well. Besides the fact that we've got the unlimited prescription drugs. So you don't have to worry about the coverage gap. You'll never be in that donut hole situation. Yes, ma'am?
Will you have the mail-in prescriptions?
We do have mail order. Our mail order through Presbyterian is through Walgreens mail order. So if you, you have to enroll in the Walgreens mail order, and then if you're, on tiers 1, 2, and 3, and you use the mail order, then you save co-pays. You save co-pays when you're on the mail order. Otherwise, it's just gonna be, and our preferred pharmacies in the state of New Mexico is every single pharmacy. Presbyterian is contracted with every single pharmacy in the state of New Mexico. If you're outside of the state of New Mexico, I recommend that people use the big chains, but we use all the small, mom and pop shops that are on the corner, and we use all the big chains right here in the state of New Mexico. I'll even tell you a secret, we're also contracted with the Loveless pharmacies. People think that's kind of weird, but we're just contracted with every single pharmacy in the state of New Mexico. So that's kind of our plan in a nutshell. I know it doesn't cover everything, well, it doesn't go over everything, and I know we don't have a whole lot of time this morning, but we are gonna have another meeting where you can come in and I'll go over the full plan, how it works. We have packets here for you today, and the packets definitely go over the full benefits on what you're gonna pay, your co-pays, whether you're in network or out of network. It's got a copy of the full formulary, it's got a provider directory, and it's also got a summary of benefits in the packet. We will make ourselves available to you between now and December 7th. If we have to have one meeting or if we have to have 3, we will make sure that we get everybody that wants to be enrolled in Presbyterian. Yes, sir.
Okay, in your estimation, what is a better plan, the HMO or the PPO? Tell me.
Well,
We have to ask
you know, I have to say that, we created the HMO point of service, and we created it, we have a PPO, we have a Presbyterian Medicare Advantage PPO.
Yeah,
It's
I have
basic-
that now.
It's basically the same type of benefits, it's the same type, you have in-network or you have
So
out-of-network.
neither one's better than the other.
In my opinion, the better benefits you're gonna get are gonna be through the HMO only because you've got that availability. If you're going to a Presbyterian provider, you've got that integration of our hospital system with the physicians and with the health plan, okay? So that's one of the examples that the HMO can give you a little bit better.
You press satellite offices.
And they're all connected.
They will not take Humana either, will they?
That is correct. They won't take any other Medicare Advantage plan. And it's not just Humana, they won't take any other Medicare Advantage
And the
plan.
hospital is the same way.
Right, that is correct. Yes, ma'am.
My question is this, when we were on the Presbyterian plan, we always had to pay a copay every time, we went to the doctor. Is that still going to be the same?
That is still going to be the same. We don't have a deductible. We don't have any deductibles at all, but you do have co-payments. Yes. There was a question over here. Yes, ma'am?
On the HMO, you have to have a referral then to go to either one of the doctors within Presbyterian.
That's a really good point, really good question, and I didn't say anything about that. Actually, we do not require any referrals, whether you're in network or out of network. You don't have to get permission from your primary care doctor, and you don't have to get permission from Presbyterian to go in network or out of network. When you go out of network, you just have to make sure that it's a Medicare approved provider and that they'll accept you. That's all you have to worry about. So that